Health Chat is sponsored by Buell Regional Health Foundation.
So trauma is a term that we use to describe something external happening, causing a person to have an injury or a wound. In medicine, they refer to blunt force trauma, baseball bat to the head, or penetrating trauma, knife to the gut. In mental health, what we're talking about is something external that creates an internal wound or injury. So technically, a traumatic event is exposure to death, injury, or sexual violence. And it could happen to you, or it could happen to someone very close to you, or you could just hear about it. But I think we need to expand our understanding of what a traumatic event is to recognize that it's any event that creates a traumatic response. And so that's an experience that causes someone to have injury to their brain or central nervous system that leads to distorted thinking. You start to see the world in a very different way. And people who have a traumatic response feel unsafe, and they sort of question everything they knew about the world. Trauma symptoms are a cluster of 4 different types of symptoms. So the first is re-experiencing. That can happen through nightmares or flashbacks. It's basically feeling like you're there again. The second is avoidance, and that's avoiding things that cause you to feel like you're there again. And you might avoid people or places or smells or sounds or situations. You can avoid a lot of things. The third symptom is arousal. And basically when you've had a traumatic response, what you've had is a fight or flight response. And that fight or flight response then becomes pretty sensitive, and it might come on very quickly, or it might actually just kind of stay there all the time. So people who've had a traumatic response tend to be anxious, on edge, looking over their shoulder, making sure they're safe, hypervigilant. And the fourth symptom in the cluster is negative thoughts or feelings. And negative thoughts are typically negative thoughts about myself, the world, or what the future looks like. Negative feelings might be shame, guilt, sadness, fear, anger. COVID-19 is a great example of why it's not so much the event, but the response that matters. So we were all exposed to COVID-19, and it was a disaster, and there were many things that happened during COVID-19. Some people certainly experienced the fear of death for themselves or seeing death around them. And there were other things that happened. Society kind of felt like it was falling apart. So there were lots of things there that could have caused a traumatic response. But what we've seen is not everyone had a traumatic response. Many people coped with it well. Some people gained some resilience from it. So it's not about the event, but about how one responds to the event. So trauma can affect anyone. And there are 2 groups that we really worry about. The first is people who've had a traumatic response in the past. If you've had a traumatic response in the past, you're predisposed to have one in the future. So those people we need to pay attention to so that if something happens, we can provide them extra support. The second group is children, and there's something called the Adverse Childhood Experiences Survey that helped us to understand that children are exposed to things in their childhood that may predispose them later to having a traumatic response. And so children we pay close attention to because if we can provide them good skills early, we might be able to prevent a traumatic response in the future. When we say Adverse Childhood Experiences, or ACEs, we're referring to a large survey that was done and has been studied multiple times. And within that survey, there were 3 adverse childhood experiences. It was abuse, physical and sexual abuse, neglect, and household dysfunction. And within the survey, household dysfunction was defined as divorce, interpersonal violence, incarceration, substance use disorders, and mental health issues. And so if one of those things was present in the household, that's considered an adverse childhood event. And what we know is that from these studies is that 70% of children experience at least one adverse childhood event. And that study's been extended to look at community level stressors as well. So within the community, things like bullying, minority stress, living in foster care, community violence, and feeling of neighborhood safety, or a lack of feeling of neighborhood safety, are also considered stressors. And when we add those into the mix, what we find is that 83% of children have experienced at least one adverse childhood event. When trauma goes untreated, it grows slowly and steadily. It starts out as little symptoms, little things that maybe we don't even notice. So they start to have difficulty with peer relations, or maybe there is some difficulty in the home. School becomes a little harder. The world looks a little different to them. And we may not notice it because that's normal for children. You know, we see kids go through phases over time. So it's hard to catch it early, but we should be watching kids carefully to see are there changes. When that's not treated and it goes a little further, what we start to see is patterns of behavior. So now there's a pattern of difficulty relating to peers, or a pattern of difficulty at school, or all of a sudden now home is starting to always feel like there's trouble. If it still goes untreated, we don't catch that as trauma at that point. What we see is ingrained patterns of behavior, serious mental illness, criminal behavior, truancy from school, household placement outside the household because the house has gotten so out of control. And actually, ultimately, we can connect adverse childhood experiences oftentimes with someone's death. There are also some red flags that have been associated with different age groups of children. So when we look at the really young children, warning signs that we're looking for are separation anxiety, so fear of separating from typically a trusted adult, difficulty sleeping. So if you're experiencing trauma symptoms or you feel that maybe a child is experiencing trauma symptoms, find them help. There are many people out there who know how to deal with trauma, to help people go through the protocol of how to manage trauma and get better. But there are some things you can do right away that are safe, that are okay to do. You can do them yourself or you can help a child do them. One is relaxation skills. So trauma involves arousal. The body gets aroused, becomes in fight or flight mode. And so we're not talking about relaxation like having fun, although that can be relaxing. We're talking about relaxing the body. And whatever you can do to help relax your body or to help the child relax their body is a good, helpful skill. It should involve two things: deep breathing, in through the nose, out through the mouth, into the belly with a long exhale. Blowing bubbles is a nice way of practicing that. And some type of progressive muscle relaxation, so tensing and releasing the muscles. The second thing you can do is recognizing how you're feeling. We don't like to feel bad feelings, and trauma comes with bad feelings. If you ignore your feelings, they will control you. If you can be aware of them, you can cope with them, maybe understand a little bit more about what's going on. There are many pathways to treatment. With programs like this that share information about trauma and all the information that's been released, many people do understand trauma and can see it when it's happening. So clergy, teachers, family members, healthcare providers, lots of people out there that can get someone to help, and that's the best thing to do. If somebody needs help and you don't know where to go, there are two resources that I always recommend. One is the National Suicide Prevention Hotline, that's 988. Yes, it's suicide prevention, but treating trauma is suicide prevention. The second is the mental health chat line, 741-741. Kids can get on there, send a text, and get support. And both of those resources will connect you with local crisis centers, but they're a good starting place 24 hours a day. And in the end, what I would like people to remember is what Mr. Rogers' mom told him. When there's chaos, when it feels like the world's out of control, look for the helpers. We're here and we're ready to help you when you're ready.